Hello everyone, welcome to BrainMindia. Today we are going to discuss about epilepsy. And for that purpose, we have in our studio a renowned doctor, Dr. Jakir Hossain Laskar. Welcome, doctor. Today we are going to discuss about epilepsy, that is basically a neurological disease. So my first question will be, what is epilepsy and what are the symptoms of epilepsy?
Actually, epilepsy is a central nervous system disorder.
Okay.
We have several kinds of nervous system. So, when our central nervous system is infected by any condition, that is called epilepsy. And main two symptoms are become prominent here. One is seizure attack, and another is loss of awareness or loss of consciousness.
Okay.
These are two prominent symptoms. And in spite of that, some people experience uncontrolled jerking movements of the arms and legs as well.
Okay.
Most of the people. And loss of consciousness is will be there always. Some psychiatric symptoms are prominent. Some patient, when come to us, they express that they are having fear psychosis for a long time. Some said they are having anxiety neurosis for several months or several years. And this seizure disorder, which is effective in epilepsy, it has two types. One is partial seizure, which is called focal seizure, and one is generalized seizure.
Okay.
And both the seizures affect the both sides of our brain. These are important signs and symptoms of epilepsy.
Okay. And my next question will be, what are the causes of epilepsy?
Causes. Yes, and there is no identifiable cause of epilepsy as of now, but research across the globe are going on. But some trigger factors are important here, which initiate seizure disorders in epilepsy. Those are genetic influence, those may be head trauma, those may be some brain abnormal conditions because of neurotransmitter abnormalities, or one important disease has cropped up as a etiology or cause of the disease, that is called meningitis. Because of meningitis, patient may suffer in epilepsy. Some prenatal injury before childbirth, it is occurred. It is called prenatal injury, and it is a developmental disorder. So those children in their later life may suffer in epilepsy as well. And lastly, immune system abnormalities are considered one of the important causes of seizure disorders.
Well, these are the causes of epilepsy. My next question will be, how can we diagnose epilepsy?
Actually, these kind of symptoms are prevalent only in epilepsy. So automatically, having listened the case study, doctors can diagnose it is a case of epilepsy. But always in the field of medical science, we prefer to have differential diagnosis. We have to have confirmation regarding the diagnosis. For that purpose, EEG, electroencephalogram, is done for diagnosis of seizure disorder. Sometimes CT scan and MRI also required. Especially MRI with epilepsy protocol works well to diagnose the disease of epilepsy.
Okay, so we have got many ideas about the causes.
No blood tests are required here.
Okay, so we have got some idea about the diagnosis. Now, next question will be definitely, how can we treat the disease? Okay, before going for that, let me ask you one thing, that is it a disorder or it's a disease?
No, it's a disease. It's a disease, and unlike other diseases, it has not that much scope in management without medicine.
Okay.
Only we say that if patients are asked to take ketogenic diet, which is high fat and low calorie, low carbohydrate diet. If they maintain ketogenic diet, the frequency of attack will be minimized in seizure disorders. Some doctors consider one more thing, modified Atkins diet, same kind of management which is asked to patients to maintain, and that also works wonder. And when medicines are not working properly, doctors consider vagus nerve stimulation therapy, doctors consider responsive neurostimulation therapy, doctors consider deep brain stimulation. Those are surgical procedures. But I want to tell you that in homeopathy there is great scope to manage and maintain epilepsy patients. Last 10-12 years I have been attending several hundred patients of epilepsy. Most of the cases are well managed. For informational purpose, I can tell you some homeopathic constitutional and therapeutic medicines which works well. Cicuta virosa 200 potency, it is a moderate potency. If it is used one dose twice a day for 1 month, it works well. One more medicine, Cuprum metallicum, which is one of the greatest choice of most of the homeopathic physicians. Cuprum metallicum 1M. It also works well in managing seizure disorders of epilepsy, and it has to be continued for 2, 3, 4 months. But in between, patients are asked to take one medicine, that is Hyoscyamus niger 10M potency, because higher potencies are not intended to repeat always. If patients are taking one dose once a month for 8 to 10 months, most of the symptoms will be minimized within that span of time. But those patients who are having severe symptoms, we consider a therapeutic medicine, that is Artemisia vulgaris mother tincture, which also works well for all age group epilepsy patients. Moderately 20 drops of Artemisia vulgaris mother tincture, if taken with a little bit water for 2 to 3 months twice a day, most of the symptoms will be minimized.
Okay.
So patients need not be worried that epilepsy has no cure. But we cannot completely cure this disease, but we can well manage this disease within 1 to 2 years of homeopathic treatment.
Okay, that is the question people are asking, that can we cure the disease?
No.
Can we cure the disease epilepsy? But you are saying that it cannot be cured completely, but we can manage it.
But sometimes if it is not a severe case, if it is in acute stage, then sometimes complete cure may be occurred with homeopathic medicines.
Okay, means if we
stage is important.
Okay, stage is very important. If we start the treatment early, then we can manage it very nicely.
Very nicely. And one thing, listen, people come to us after having treated by other pathies for 4, 5, 10 years. We are getting scope to treat those patients after 10 years of having the disease. So that is important. Okay, that those patients we have to think of managing only.
Okay, means you want to say that if we start early, if we start treating the patients early, then it will be very easier for all of us to manage the disease.
Yes, always acute stage of epilepsy is well managed by homeopathic treatment.
Okay, thank you very much for your suggestions.
Thank you.
So that's all for now. See you in the next episode. Thank you.